had uterine surgery or hysterectomy know that the recovery can be long and painful. So when a new technique known as morcellation became available, which allowed laparoscopic hysterectomies or uterine fibroid removal, it was seen as a great medical step forward. Traditional hysterectomy surgery removes the uterus in one piece with incisions that may be 3 to 7 inches long. The power morcellator uses keyhole surgery, cutting the uterus into small pieces that are removed through the tiny incision. Sadly, morcellation has been linked with the spread of a rare but deadly form of cancer known as uterine sarcoma. The morcellator has a rotating blade on its end, similar to the tiny blades in a blender, which chop large body tissue into smaller bits that can then be removed through the keyhole incision. But think for a moment, what happens if you power up a blender but forget to put on the lid? A morcellator has a similar problem. Some bits of body tissue can be dispersed throughout the abdominal cavity. Sometimes bits of fibroid can take hold and grow in other parts of the body. But in some cases, the bits of tissue that are chopped by the morcellator harbor cancer cells. In that case, it's like tossing cancer seeds. Cancer that had been contained in the uterus now spreads throughout the abdomen. The U.S. Food and Drug Administration estimates that 1 in 350 women who undergo hysterectomies and myomectomies have an undetected uterine sarcoma. Research shows that uterine surgeries performed using morcellators may significantly reduce the odds of long-term survival in women with undetected uterine sarcoma. The FDA has issued a safety communication discouraging surgeons from using power morcellator devices in hysterectomies and removal of uterine fibroids. FDA officials recommend doctors discuss the cancer risks associated with morcellator surgeries with patients prior to operating. So, what does this information mean for women? According to the FDA, if you've already undergone a hysterectomy or surgery for fibroids, tissue removed during the procedure is typically tested for the presence of cancer. If you are informed these tests were normal and you have no symptoms, routine follow-up with your physician is recommended. Patients with persistent or recurrent symptoms or questions should consult their healthcare provider. If your doctor recommends hysterectomy or uterine fibroid surgery, ask if the plan is to use a morcellator and request an explanation of why he or she believes that this is the best option given the increased cancer risk. HensonFuerst is currently taking cases of cancer spread after morcellation surgery. If you had a surgery using a morcellator and have since been diagnosed with cancer in your abdomen, please contact us at 800-4LAW-MED for a free consultation. Medical device manufacturers have powerful legal teams dedicated to protecting their profits. Our experienced attorneys are here to protect you. Contact us today. If you have questions, HensonFuerst has answers.